Is now starting. All attendees are in listen-only mode.
Good day, everyone. Thank you for joining and a warm welcome from Geneva to our webinar focusing on the upcoming discussions on the WHO resolution on rheumatic fever and rheumatic heart disease. My name is Jeremiah Mwangi. I'm the Director of Policy and Advocacy at the World Heart Federation, and I'm joined on the webinar by my colleague, Alistair White, our Policy and Advocacy Officer. Before we begin, just a note to say that we will be recording and sharing the webinar. There will be a Q&A at the end, so please do send us any questions and we'll do our best to answer these. We will also include the advocacy team email address on the last slide should any questions occur to you afterwards. So just to quickly run you through the agenda for today's webinar, we'll start by giving an overview of the events and discussions that have led us to this stage, the WHO resolution, and what recommendations and commitments are included in the current draft of the resolution. We are also joined by Lucy Richardson from the Permanent Mission of New Zealand, the government leading the resolution process, and we will have a Q&A session with her to find out more about the actions governments are taking on rheumatic heart disease and the role civil society can play in moving the resolution forward and implementing the resolution. After that, we'll highlight some of the advocacy resources available to you as part of our Time to Tackle RHD campaign and look ahead to the World Health Assembly itself. And as I mentioned before, there'll be a chance to ask questions at the end of the webinar. So I'll now hand over to Alistair, who will provide some background to the resolution and its contents.
Thanks, Jeremiah. I will start by giving an overview of the process that has led to the debate on rheumatic fever and RHD at the World Health Assembly in 2 months' time. So it began with government discussions led by the government in New Zealand when several countries decided that rheumatic fever and RHD should be considered a global public health priority. And resulting from this, it was tabled to the 140th session of the Executive Board. However, the WHO decided to add RHD to the agenda at the 141st session of the WHO EB meeting, which took place from the 1st to the 2nd of June last year. Then at this meeting, the draft resolution was adopted by the Executive Board. The title of the resolution had now been expanded to include rheumatic fever as well as RHD after a suggestion from the government of Thailand. This was partly to place more emphasis on primary and secondary prevention of RHD as the most effective approaches to tackling this disease. And moving now to the present day, we find ourselves in March 2018, and our focus is now on, firstly, the World Health Assembly from the 21st to the 26th of May, and then how we can implement the recommendations of the resolution from June 2019 onwards. So to take a step back briefly, what is a WHO resolution? It is a piece of written policy agreed by all of the countries or member states that make up the World Health Organization. In terms of its contents, a resolution contains clear commitments and actions and needs to be passed by consensus at a World Health Assembly. In practical terms, that means there must be no countries that oppose the adoption of the resolution at the World Health Assembly, rather than needing to have all countries actively supporting or voting for the resolution. Once passed, this resolution will effectively put RHD on the official work plan of the World Health Organization. What this means is that decision makers, including governments and the WHO, will need to recognize that RHD is a global priority and address and fund it appropriately. The resolution document itself was written by a group of governments led by New Zealand. When a resolution is discussed, it's also accompanied by an official report from WHO, which calls for a coordinated global response to tackle RHD. This WHO report on rheumatic fever and RHD was discussed at the Executive Board last year in June, and provides background information on the pathogenesis and global prevalence of RHD, approaches that can be taken to make progress towards prevention, control, and elimination. It also outlines barriers to progress, what the Secretariat of the WHO's response has been to date, and also what next steps should be taken. So what's in the current draft of the resolution? It contains actions and recommendations for 3 different groups. These are member states or countries, the World Health Organization, and what the resolution refers to as relevant international stakeholders, which includes NGOs, academic institutions, philanthropic organizations, and relevant private sector entities, such as manufacturers of essential medicines, for example. So firstly, the resolution calls on member states to take action in 5 areas. These include improving access to primary healthcare, strengthening data collection and knowledge of RHD prevalence in endemic countries, ensuring affordable and reliable access to technologies and medicines, strengthening national and international cooperation, and tackling the root socioeconomic determinants of health. Secondly, the resolution invites all stakeholders to collaborate with WHO and member states in order to put people living with RHD at the centre of the prevention and control agenda. It makes 2 other recommendations, which are to raise the profile of people living with RHD and other NCDs of children and adolescents on the global health agenda. And it also asks for the cooperation of these stakeholders in facilitating reliable access to existing and new cost-effective medicines. Finally, it makes 5 requests to the Director General of the WHO. The key request among all of these is that WHO should lead and coordinate global efforts to prevent and control RHD, and includes a recommendation that RHD should be considered broadly across relevant WHO work areas, extending beyond just the NCD programme. The additional requests the resolution makes of the WHO are to support member states to measure their RHD burdens and implement programmes. Secondly, to foster international partnerships. Thirdly, to monitor efforts for the prevention and control of RHD. And finally, to report on the implementation of this resolution to the 74th World Health Assembly, which will take place in 2021. So that's a brief overview of the resolution and its contents. I'll stop there for the time being and hand back to Jeremiah.
Thanks, Ali. So I'm now delighted to welcome Lucy Richardson from the Permanent Mission of New Zealand to the UN to discuss the upcoming resolution and the debate that we expect at the World Health Assembly. Before we go ahead, I would like to say a special thank you to Lucy and the Government of New Zealand on behalf of the RHD community for the leadership you have shown in putting RHD on the agenda. There have been some bumps in the road, but thanks to your perseverance, we have a great opportunity ahead of us. So just to get us started, I think it would be helpful for people on the webinar to know a bit about yourself and also what your role at the Permanent Mission involves.
Sure, and good morning or good evening, good afternoon, whatever time it is, wherever people are listening. It's really a pleasure to be here and have the opportunity to talk about this with you. As you said, I'm based at the New Zealand Permanent Mission to the United Nations here in Geneva. I cover health matters there, so unfortunately RHD isn't the only thing I work on. It's part of a much broader portfolio. I cover health and also other UN agencies, so some days I'm working on quite different aspects. Things maybe one day labour, the next day environment. Now you mentioned the perseverance and I very graciously accept your thank yous to New Zealand, but it would be remiss of me not to say that, of course, we direct very much the same thing back to WHF. This has been very much a team effort up until here, and the fact that we're all bringing along our different expertise to the table is what I think has got us to this point now, and what will get us across the line when we get to the Assembly in about 2 months' time.
Great, thank you. And it would be great if you could provide some context to how New Zealand first came to lead this process for a resolution, what inspired you to get involved.
Okay, absolutely. The short version is we became to lead on this because for New Zealand, RHD is not only a theoretical issue, it's very much a practical issue for us. We were aware of the seriousness of this in our own society and in our own region, the Pacific region. And then in coming to the WHO and having discussions with people from other regions, we began to hear that other regions and other partners were also experiencing the same thing. They also considered that this was an issue that needed greater attention. So more concretely, our work in this area started with New Zealand's own rheumatic fever prevention program. And then in the discussions that we were having at the global level, where with you and also countries from all the WHO member states, where we began to explore whether this was a priority that ought to be raised again to the level of the WHO's executive board. And Alistair ran through a moment ago some of the steps that led us up to that. I think you started at the beginning of 2017. As many of those listening, and you know the process, of course, started much before that. We really kicked off in May of 2016. We held an informal meeting at the WHO where a number of health ministers were able to attend. And it was at that meeting for us where we had the confirmation from each of there were member states present representing each of the WHO regions, where we really had the confirmation that this was an issue of sufficient priority, that we ought to look to raise it up to the level of the executive board. New Zealand, as one of the 34 members of the executive board, then agreed to take that issue forward. Now, every country has their own particular priorities, and there are many good candidates for inclusion on the agenda at the WHO. So the process of gathering consensus among all member states to raise any new item on the agenda takes time. And as you mentioned, some of the many steps that have been along the way up until now. We've had the virtual work. We've had a core drafting group of RHD experts from around the world who worked by email and teleconference, coming up with the core elements to put in the resolution. And then here at the Geneva end, we've been working for about 18 months now, or a little under 18 months now, in various combinations of member states to have them all on board as to understanding why this is a priority as well. Started working with in small groups of interested states, and then we eventually broadened it up to all member states. So that's how we got there. Seems like a lot of small steps have already taken place. Of course, the big ones are still to come: the passage of the resolution and then its implementation, which is the key aspect.
So you highlighted why New Zealand became involved and why it's important to you. And I wonder if you could say a little bit about what difference you think that the resolution can make.
Well, what we're hopeful that the difference the resolution can make is that we'll have an impact on what we consider to still be an unacceptably high burden of RHD globally. The numbers of people being impacted still by a preventable condition are unacceptably high. And so we see this text as a global call to action for member states, for the WHO and the other partners, including civil society. The key actions that are needed to reduce the RHD burden are already known. That's not what's missing here. As we see it, it's having that concerted action and attention on the global level and leadership from the WHO that will make a difference. And I think that there's a line in the resolution which says, recalling that global initiatives can provide much needed leadership, awareness and momentum to beat rheumatic heart disease. So that's what we're aiming to do. Our focus here, of course, is rheumatic heart disease, but I think it's also worth noting that a lot of the actions that we're considering as necessary here to prevent RHD will also benefit other diseases, and we think many of these actions are aligned with the SDGs as well, things like reducing poverty, improving equity, and so on. So the key focus is RHD, but we think it's a nice spin-off as well, that this resolution will also have impacts elsewhere. The last point I'd like to make as to what difference we think the resolution can make we already, under the last Director General of the WHO, Dr. Chan, had support for looking at this as a cross-cutting issue. So that was already there. With the new Director General, Dr. Tedros at the WHO, and his new plans for, he's been, some listeners will be aware of the process around the new general program of work that's going through. This approach to deal with issues very much on a cross-cutting basis. So not only one single department working away on this issue, but all of the relevant divisions and all of the relevant departments working together on this. We think that's absolutely what's necessary for RHD, and we think that in the current climate at the WHO, with the new general program of work and that leadership in that direction from the new DG, that the timing is really opportune as well.
Great, thank you. That's, I think, again, we want to also kind of acknowledge the importance that the resolution will hopefully lead to action and greater leadership on the part of WHO, but also see countries come together to support each other in tackling the burden of RHD. And I guess that leads me to another question, which is really just to think back historically, and are there any global efforts that you've seen or are aware of to tackle rheumatic fever and RHD that you think that we can build on in this work?
Well, one of the reasons that we are so confident that having a program again at the WHO is a good idea is because, of course, it's not the first one. There was one previously which had good results, which leads us to believe that the same could certainly be the case again. It was before my time, of course, but there was a global program running at the WHO for prevention and control of RHD from 1984 until 2002. So it's not entirely new, but it dropped off the radar, which is why we're seeking to reinstate it. At the global level too, there are also targets relevant to the reduction of rheumatic fever and rheumatic heart disease, and a number of other key global documents. Thinking here of the WHO's Global Action Plan on NCDs, which has relevant targets. Also in the SDGs, if you look at the targets on preventable deaths of children, on reducing maternal mortality, and so on, which, as we know, in some places is significantly contributed to by RHD. So most deaths from rheumatic heart disease are premature, and we think that controlling RHD will contribute to fulfilling those goals elsewhere. Now, those are at the global level. Also at the regional level, there's been some significant efforts. I know in my own region, the Pacific Islands area, the health ministers there have been very engaged on this issue. But also at the level of the African Union. In 2015, African Union leaders came together and agreed the Addis Ababa Action Plan as well. And we have a reference to that in the resolution to acknowledge their leadership and commitment in this area.
Great, thank you. And I guess from global efforts and regional efforts brings us to national efforts. And I think, again, a key part of this resolution is about sharing experiences, best practices, and building on the work that's being done in different countries around the world. And it would be very interesting to hear a little bit from you about the action that New Zealand has taken to prevent and control RHD. And I'm aware also that New Zealand has been working on things at the national level, but has also supported some regional initiatives as well. So if you'd like to touch on those, please do.
Sure, thank you. Well, so the focus in New Zealand has been on preventing rheumatic fever through our rheumatic fever prevention program. This was a program which was established in 2011 to prevent and treat strep throat infections, which can lead to rheumatic fever. In 2012, the program was expanded significantly, and a target was introduced to reduce rheumatic fever down to about 1.4 per 100,000 people by the end of June 27. That was the target. And the New Zealand government invested about $65 million to identify and trial new initiatives to reduce rheumatic fever rates. Our prevention program had three main strategies. The first one was on increasing awareness of rheumatic fever, what causes it, and how to prevent it. This awareness raising strategy included initiatives like multimedia initiatives, youth campaigns, online learning resources for nurses and community health workers. And it had initiatives focused specifically on the communities where the prevalence of RHD is highest, which in New Zealand is Indigenous Māori communities and Pacific communities. The second part of our strategy was on reducing household crowding and therefore reducing household transmission of strep throat bacteria within households. Because the group A streptococcal throat infections are an infectious disease, it's plausible biologically that reducing household crowding would reduce the transmission of those infections and therefore contribute to reducing rheumatic fever. So the action plan on reducing household crowding and rheumatic fever had three outcomes. It was aimed at creating a sustainable system to provide emergency housing and support, increasing the supply of affordable housing, and improving the quality of housing. And under this plan, there were a number of initiatives, things like addressing the health and social issues for families who were in need of emergency housing. There was work done with energy retailers to promote different product options and concession rates for families whose children were identified as being at risk of rheumatic fever. Again, with families who were identified as being at risk, there was strategies to fast track those families who needed to be fast tracked on the social housing register to access larger housing. And there was also work done improving the quality of homes, which in New Zealand focused largely on increasing insulation. And then just the last part of our prevention strategy was on improving access to timely and effective treatment in the priority communities. This had a number of elements as well, school-based programs, and it expanded to the implementation of free drop-in clinics led by nurses for high-risk populations. That program that we had ended officially in June 2011. But rheumatic fever prevention continues to be a high priority for there are 11 district health boards which are still identified as having a high incidence of rheumatic fever. So the attention now has shifted primarily to those areas, and there's been an allocation of an additional $5 million per year until 2022 to those regions so they can continue to focus on prevention activities. There have been, you mentioned also regional efforts and so on. I don't have everything in front of me as to exactly what's gone on there. My colleagues in the health ministry in Wellington would be able to tell us more, but I'm aware there have been some initiatives, and actually even in the process of this resolution I became aware of new ones which I didn't learn about. Just as an anecdote, I approached my colleague from Zambia at one point to talk to him about the resolution and to gauge his country's interest. And I didn't know before approaching him that he was a heart surgeon and had worked on rheumatic fever. He had worked with New Zealanders in his own country and had a friend who was a Zambian surgeon working on RHD in a program in New Zealand. So it's perhaps an anecdote, but it was nice to learn about. He was able to educate me about something that was going on in my own country that I hadn't yet learned about.
No, and I think it's a good example because that is the way that many countries have been tackling RHD to date, is by the sharing of resources, expertise, working with different people around the world. And you do see a lot of connections between countries that maybe is not at the institutional level, and perhaps through the resolution we'll see more cooperation in that light. And I guess speaking about different countries, that brings me to a question about which other governments are co-sponsoring the resolution alongside New Zealand.
So the resolution, when it was before the executive board, had a nice group of co-sponsors from all the regions. I think you can see them on your screen there for those who are listening along, so I won't read them out. I do notice, looking at the list, one that is missing. Thailand was also a co-sponsor. at the Executive Board. Now, coming to the passage of the resolution through the Health Assembly in May, we expect all of those countries still to be there, and we look, of course, to significantly expand that list. The Executive Board only has 34 members, and not all member states are able to participate in those meetings. The Health Assembly is the universal membership organ of the WHO. So all states are there, even for instance, in the Pacific Island region, many of the small island states for whom rheumatic heart disease is a utmost priority, they're not permanently based in Geneva. They don't have missions here, so they're not very often attending sessions of the Executive Board, but they'll all be here for the WHO. So we expect that list will go up. I'll certainly be working on that, and I don't doubt that our partners in civil society will be very much doing the same thing.
Great, and I think that turning to civil society, I was wondering if you could tell us a little bit about how, as civil society, and I think this is a question that many on the webinar are interested in, how can we best support this process? So at the national level, even if we're in countries where the country is already supporting or is a co-sponsor, but other countries who are interested, how can we add to this effort and make sure that we get a resolution? But then also, what can we do afterwards?
Okay, so there's two key things, I think, and you've really touched on both of them. There's the advocacy and the implementation. In advocacy, I think where civil society partners in particular really assist with the deliberations that take place at the WHO is in providing that real people-centered perspective, particularly bringing to the forefront the experiences of people living with RHD. Even with all the best intentions in the world, the diplomats and who are working for member states in the WHO, this will be one of many issues that they'll be dealing with at a given time. And it's really helpful for them to be able to understand why this is important, and bringing that people-centered approach, that real human element to this is really vital. There's again, I want to refer back to the resolution, because as I think Alistair mentioned at the beginning, there is a paragraph which focuses exactly on an invitation to what relevant stakeholders, including NGOs, academic institutions and others can do. And I'm just going to read it out, because it says, to assist in driving forward global efforts for the prevention and control of RHD, to put people living with RHD at the centre of the prevention and control agenda, and to continue to advocate on behalf of communities at risk of or affected by RHD. And I think that's it in a nutshell. We know already that civil society play a really valuable role in contacting decision makers in their country, whether they've already supported the resolution or not. It's important to do that. I would encourage people to, as they can, to contact decision makers in their health ministries and also their foreign ministries, because governments, as with everybody else, it's not always easy for people to be connected up. And when you get to if you're having discussions with your colleagues at the health ministry in capital, it's important that those are going to be transferred across to the decision makers here, who delegations at the WHO will typically be a mix of people from health ministries and foreign ministries. People from the foreign ministries, which I count myself among those, will not be medical specialists. They won't be medical doctors. So in your advocacy to those people, that's where it's really important to give the simple facts of why this is important, and as we say, put the real stories from you on the ground. The next step, of course, in implementation is in using the resolution as a tool for accountability. The resolution is your blueprint for going back to those decision makers, for going back to your governments, for going back to the WHO, for going back to all of those organisations and other stakeholders who are identified in the resolution, and following up on where they're at in those key actions which are identified. Now, on that point, I guess I could say too, the resolution doesn't contain everything that you could ever be doing. It's not prescriptive. Resolutions are at their best when they're able to remain fairly short and punchy. And one of the things we did in the negotiating of this text was to try and keep it really to the key priorities, because as soon as a resolution is more than a few pages long, it becomes a bit unwieldy and it becomes a bit difficult, and people look at it and think, oh, this is it's too easy to put it in the too hard basket and leave it there. We didn't want that to happen. We really want this we don't want this to be a resolution that the ink dries and nothing happens. That is not of interest to us. We want it to be used. So the key actions are guidelines. There will be other things that people may wish to do, but civil society will, as always, play a critical role in using that resolution to come back to decision makers and follow up for accountability on what they're doing.
Great. Well, thank you. That's the last question from me. And I hope that you'll be able to stay with us for the question and answer session towards the end of the webinar. But just again to say thank you very much for your efforts and for the advice that you've offered to us. I can say for sure that within RHD Action and the whole RHD community, we will stand alongside you and support the efforts that are being made, and look forward to May when the resolution is hopefully adopted. So thank you.
Thank you very much. We make a good team.
So with that, I'd like to hand back to Alistair, who will talk a little bit about our Time to Tackle RHD campaign.
Thank you. And this, moving on to leading on from what we were just discussing and in terms of what civil society can do, and this refers specifically more to the advocacy side of things between now and the World Health Assembly, rather than the very important second step of what Lucy mentioned in terms of implementation and monitoring after the resolution discussions in May. So as some of you may know, last year before the Executive Board, we launched our civil society campaign, Time to Tackle RHD. And this was to advocate to governments to support the resolution and to recommend it to be adopted at the World Health Assembly. And during this campaign, we managed to engage advocates, health workers, people living with RHD from 50 different countries around the world. And fortunately, it was recommended for adoption at the World Health Assembly. So once again, with the World Health Assembly just 2 months away, we've recently relaunched the campaign. In terms of what that means for the World Heart Federation, we have begun to meet with government officials in Geneva to discuss the contents of the resolution and how countries that where RHD is endemic might begin to support implementation of the resolution from June onwards. However, we are also seeking your support in this campaign. One key action you can take is to advocate to your Ministry of Health to inform them of the burden of RHD in your country, to let them know that RHD is a priority, and to support the resolution and really outline how this can help to reduce the burden of RHD in your setting. To support this advocacy, we have produced a campaign pack. This is an updated version of the resources that we included for last year's campaign. And these include a background information, a template advocacy letter, and more. The resources are available in English, French, and Arabic. And equally, if you would like to advocate to your national decision makers but don't know who to contact, please get in touch with us and we will support you in any way you can and try to connect you to the relevant figures. And if and when you have advocacy wins, and as Lucy mentioned, particularly if you can really share stories of people living with RHD, health workers, how this is really relevant on a human scale, please get in touch with us. We'd love to share your stories in our communications and directly in our advocacy with governments. And finally, we thought we would look ahead to the World Health Assembly itself, which this year is being held from the 21st of May and will end by Saturday the 26th. The preliminary agenda and timetable are now online. We'll make the PDF version of these slides available afterwards so that you can access these hyperlinks. The current agenda and timetable suggests that RHD will be discussed on the Thursday and Friday. We will keep you updated on the timing and how to follow these discussions. The World Health Assembly is always a hectic week, and with many countries bringing together large delegations, and especially this year, there are a number of complex agenda items to be discussed, such as the General Programme of Work and the UN High-Level Meeting on NCDs. And therefore, for this reason, the agenda always changes, and often at the last minute. So we will share updates to when the RHD discussions will be held and how you can follow those online via social media and via email so that you can follow the debate. I've also included on this slide a hyperlink to the draft resolution as it was discussed at the 141st Executive Board. There have been some minor edits and updates to this resolution since, and the updated version will be made available online in the next month or so, and again we will share this with you. A key opportunity for us during the World Health Assembly Week to raise the profile of rheumatic fever and RHD will be a side event that we are co-organising on the evening of Wednesday the 23rd of May. In this event, we aim to highlight the resolution, what it means for people living with RHD, and for health workers and carers that are working to prevent, control and manage RHD. We'll try to keep the focus of this on the impact RHD has on communities around the world and how the resolution can help to reduce the burden for these communities. We will also hear from people living with RHD and health workers during the event, and we are in the process of approaching different governments to speak and participate. And finally, a key goal for us at this event will be to highlight how RHD really is a cross-cutting issue, so how it's relevant to different global health and development agendas, and how it cuts across different sectors such as maternal and child health, health system strengthening, and NCDs. I'll stop here and hand back to Jeremiah.
Thank you, Ali. So we'll pause briefly here to give everyone listening a chance to ask any questions you may have. As we are recording, to avoid any audio issues, we will only take written questions, and so we've muted everyone's microphones, but you should be able to find a chat box available to you. I think if you click on the orange arrow, it should expand the menu of options, and then there's a chat box towards the bottom of that window that opens. As we mentioned already, Lucy is also here and available to answer any questions. I think it's important to remind ourselves that Lucy is, as mentioned, more working on the political side of things here in Geneva rather than on the technical side of things. And so if there are any questions we can't answer, we will certainly come back to you. And while we wait for any questions to come in true diplomatic fashion, Lucy passed a little note over to us during one of the slides, just to highlight, I think Ali mentioned in our Time to Tackle RHD campaign, the first bullet point was about advocating to your Ministry of Health, but Lucy wanted to reiterate that it should also be with advocating to your foreign ministry to ensure those colleagues are also engaged, but potentially as well to the Geneva and Bern missions here in Switzerland. So not just to the Ministries of Health, but to a range of different political teams and departments. I mean, if you want to expand this.
I think that's important. It links to the last thing just that Alistair said about this. This isn't only a single issue, and it may be that depending on the country's circumstances, the team that will work on this won't necessarily be the same. It may be, you may get your Ministry of Health colleagues very interested, but in other countries, depending on their circumstances, it might be those who are working more on development issues, for instance. It might be people, it could be people working on migration in the current climate. You just don't know, depending on your country's circumstances. So I would definitely suggest that in your advocacy work, as appropriate for the circumstances in your country, that in addition to the Ministry of Health, it may well be appropriate to approach other actors in your foreign ministry and your Geneva permanent mission. I'm not suggesting that you harass anybody, that would be counterproductive, but just that a wider range of decision makers could be a useful approach.
Thank you. A question has come in, and the question says, I'm wondering if the resolution covers any gender aspects on RHD, as we are working in Timor-Leste both on highlighting high prevalence but the disproportionate impact on women and girls.
I don't have a copy of the resolution in front of me. I recall the discussions that we had on this because, of course, there is a disproportionately high impact on women and girls, as the question is highlighted here.
I mean, I have a copy of the resolution, and I think that in the opening paragraphs where there is the resolution recalls other strategies and other areas, there's reference to the global strategy for women's, children's and adolescents' health and ensuring the tie-in with that work, as well as specific reference to the groups affected by RHD, so especially among vulnerable and marginalised groups, including children, adolescents, pregnant women and poor and indigenous populations.
Exactly.
So I think that it's very upfront in the resolution about the need to focus and make sure that work is aligned with those other strategies.
Yes, and in the discussions, the preliminary discussions that we have been having with staff at the World Health Organization on the implementation of the resolution, there have been people working in this team in the area of maternal, newborn and child health. So there's definitely an awareness of that aspect of this issue.
We have another question which relates to, does the resolution deal with aftercare of people living with RHD? And if I can take a quick stab at that one, I would say that one of the things when we were working on the resolution, one of the aims was about ensuring that it offers support to people living with RHD across the whole continuum of care. So I think that, as mentioned from the New Zealand side, a lot of work has been done on the prevention aspect, but in other situations, the focus has been more on the access to treatment, has been on the surgical side of things, and then on support groups for people living with RHD. So I think that we've tried to make sure that the resolution recognises all of those efforts and ensures that investments take place at all of those levels. But I think part of that question addresses the importance of why we need to have people living with RHD front and centre in the discussions in Geneva and in terms of the implementation after the adoption in May. We have a question from Fiji, and I think this one may be more towards you, Lucy, which is, what are the risks that you anticipate that may prevent the resolution being adopted?
Sure, and I would just like to acknowledge here the role of Fiji to date and the work on this resolution. Fiji is, of course, also a member of the executive board and have been really supportive right throughout this process. New Zealand usually hosts and will do again this year, a meeting of Pacific Island countries' health ministers in the margins of the World Health Assembly. We expect to do that again and expect again to be discussing RHD there. To the particular question, what are the risks, if any, that you anticipate may prevent the resolution from being adopted? Well, I am very hopeful the resolution will be adopted, and I would think at this point, there's a very good chance that it will be, but you never know. If you go back to you can find online the summary records of the discussion that took place in the executive board when the resolution was passed there, and there were some countries that had concerns. From my perspective, the concerns that they had were more of perhaps a process nature. They tended to be countries without a high prevalence of RHD who perhaps didn't necessarily understand from the beginning the approach that we were aiming for. They were concerned about the idea of a single disease-specific resolution. Our response to that was that this is not a single specific disease-specific resolution, really, because it involves such a wide range of different areas and it involves such a a spectrum of departments at the WHO. But what you can't rule out is that delegations change, individual diplomats change. Some countries will come along to the WHO who weren't present at the executive board, and they may have questions or concerns that we haven't heard of to date. We'll be engaging in outreach, of course, prior to the actual decision-making phase at the end of the assembly. We'll be engaging in outreach with countries to try and identify if there are any concerns we're not aware of, and be sure that we address them. But that would be the potential risk.
We have another question specifically referring to the Group A strep vaccine, and the question is, does the draft resolution include any reference to one? I think it's a very topical issue at the moment. And from the last version that I looked at, there wasn't specific language related to a vaccine, but it could be inferred. And I think there would be some call to see slightly more specific language included. And this may be putting you on the spot ahead of time and require further consultation, but
okay, it's fine to put me on the spot. What I do recall is that in the report of the Secretariat, you correct me if I'm wrong, but my recollection is that in the report of the Secretariat, which was prepared for the discussion of RHD that we had in the Executive Board, and that report is publicly available on the WHO website, there was a reference there there was a paragraph on potential future work, and there was a reference there. If there, of course, we will have discussions on this resolution. So if there are issues that people really wish to see included, then they'll have opportunities to raise that.
Thanks. Then we have a very big question, which is probably directed to all of us in different ways, which is, what's the hope after the resolution gets passed? That each country adopts and starts implementing the recommendations, and what would be our recommendation for each country at that point? And I think from our side, one of the things that we think is critical is that this draws attention to ministries of health, that they take that first step in assessing the burden, because there's still a number of countries that we're aware of where RHD is present, but where the Ministry of Health is not acting in a very significant manner to address it. And so from our standpoint, we would hope that the resolution would get people to start thinking about RHD and to then undertake an assessment of the burden and to then take steps to address it. And so that's really a starting point from our side. From the New Zealand side.
Well, I agree with everything you said. I think also a hope that we have. When you asked me a moment ago, how did New Zealand first come to be leading this in the WHO, and I talked about how in our experiences of coming along and talking with other countries at the WHO, we were able to have the discussions and learn that other countries were experiencing similar things that we are. We hope that by having this program in place at the WHO, which has amazing convening power, I mean, the power of the WHO to bring together people from every country for these meetings is an amazing platform to bring attention to an issue, and it helps people to. What we hope is that it will become a platform for information sharing, for sharing of good practices. That people in countries will know where to go and who to talk to follow up on these matters. A more cohesive approach to these questions.
Great. Well, thank you. And that's all the questions we've had, and we are coming to the end of our time. So if there aren't any further questions, I'd like to just invite Lucy if there are any final comments you would like to make before we draw to an end.
Only to say thank you very much for having me, and thank you for all the questions. it's been a real pleasure having this discussion with you, and also the work that we've done over many months. Your contribution to this process is absolutely central and essential, and we look forward to continuing that over the coming weeks.
Well, thank you very much for that. I mean, I think our contribution is our role through RHD Action, through WHF, through REACH is very much about bringing the community together and being a point of focus for the different views and opinions. So your thanks is also passed on to everyone who's engaged with us in this work. And so I'd like to just thank everyone for joining us on the webinar. Please do keep us updated with your efforts between now and May. Do not hesitate to get in touch via the email address on screen. If any other questions sprang to mind, or you wanted to just continue the conversation, please do get in touch with us. We'll be very pleased to work with you and to continue that dialogue up until a hopefully successfully adopted resolution in May 2018. So thank you, and we'll be in touch again soon.